In 2013, a sinister conspiracy shook the nation's healthcare system to its core. Known as Operation Root Canal, it exposed fraudsters exploiting Medicare and Medicaid. The FBI uncovered a network siphoning billions from taxpayer-funded programs. This operation highlighted the fragility of our healthcare system. Spanning multiple states, it led to hundreds of indictments. Operation Root Canal aimed to restore faith in our healthcare system. It was a testament to law enforcement's commitment to combat fraud. Healthcare fraud, often dubbed a silent epidemic, represents a pervasive threat to the very fabric of our society. This insidious crime takes on many forms, from billing for services never rendered and upcoding procedures to dispensing unnecessary medications and filing claims for fictitious patients. The consequences of healthcare fraud extend far beyond mere financial losses. This illegal act drives up healthcare costs for everyone, burdens taxpayers, and jeopardizes the well-being of patients who may receive inadequate or inappropriate care. The human cost can be devastating, leading to misdiagnoses, delayed treatments, and even loss of life. Furthermore, healthcare fraud undermines the integrity of the entire healthcare system, eroding public trust in medical professionals and institutions. It diverts resources from legitimate healthcare providers and stifles innovation in the industry. Combating this menace requires a multi-pronged approach involving law enforcement agencies, healthcare providers, insurers, and the public working together to detect, prevent, and punish those who engage in this reprehensible act. The Federal Bureau of Investigation, renowned for its unwavering commitment to safeguarding the American people, stands as a formidable bulwark against the scourge of healthcare fraud. Armed with a specialized healthcare fraud unit, the FBI dedicates substantial resources to investigating and dismantling complex fraud schemes that target taxpayer-funded healthcare programs. These dedicated agents, equipped with specialized training and cutting-edge technology, work tirelessly to unravel intricate webs of deceit and bring perpetrators to justice. The FBI's role in combating healthcare fraud extends beyond mere investigation. The agency collaborates closely with other federal, state, and local law enforcement agencies, sharing intelligence, coordinating efforts, and providing investigative support. Moreover, the FBI engages in extensive outreach and education initiatives, partnering with healthcare providers, insurers, and the public to raise awareness about healthcare fraud, promote prevention strategies, and encourage the reporting of suspicious activities. Operation Root Canal, aptly named for its focus on exposing deeply rooted corruption, unfolded as a meticulously planned and coordinated nationwide takedown. This operation, which spanned multiple states, involved the collaboration of hundreds of FBI agents, forensic accountants, data analysts, and support staff working in unison to dismantle a sophisticated network of healthcare fraudsters. The operation targeted a wide range of healthcare providers, including doctors, dentists, pharmacists, and medical equipment suppliers, who were suspected of engaging in fraudulent billing practices, kickback schemes, and other illicit activities. Undercover agents, posing as patients and healthcare professionals, infiltrated the ranks of these criminal enterprises, gathering irrefutable evidence of wrongdoing. Wiretaps, surveillance operations, and the analysis of vast troves of financial records provided further insights into the extent of the fraud. The success of Operation Root Canal hinged on the seamless coordination and collaboration between the FBI and its law enforcement partners across the nation. Section 5. Faces of Deceit. The perpetrators unmasked. Operation Root Canal shone a spotlight on the audacity and depravity of individuals who sought to enrich themselves at the expense of taxpayers and vulnerable patients. Those ensnared in the operation's net included a rogues gallery of healthcare professionals, businessmen, and organized crime figures, all driven by greed and a callous disregard for the law and human well-being. Among the key players were doctors who billed for phantom procedures, prescribed unnecessary medications for kickbacks, and falsified medical records to inflate reimbursements. Pharmacists colluded with recruiters to dispense medications to patients who never received them, billing Medicare for the full cost. Medical equipment suppliers provided unnecessary or substandard equipment, often bribing healthcare professionals to secure referrals. These individuals, driven by a thirst for illicit profits, exploited the complexities of the healthcare system, preying on the trust of patients and the government. Their actions not only defrauded taxpayers of billions of dollars, but also undermined the integrity of the healthcare system and jeopardized the well-being of countless individuals. Section 6. Florida, a hotbed of deception. Florida, long considered a haven for retirees and tourists, unfortunately, earned an unwelcome reputation as a hotbed of healthcare fraud. The Sunshine State's large, elderly population, coupled with its sprawling healthcare system, created fertile ground for unscrupulous individuals seeking to exploit vulnerabilities within Medicare. Operation Root Canal exposed rampant fraud in various sectors of Florida's healthcare industry, including durable medical equipment companies, home healthcare agencies, and pain management clinics. These fraudulent enterprises often employed aggressive marketing tactics, targeting elderly and disabled individuals with promises of free or discounted medical equipment and services. Once enrolled, patients were subjected to unnecessary tests and procedures, while Medicare was billed for services never rendered or grossly inflated in cost. The scale of fraud uncovered in Florida was staggering, with billions of dollars siphoned from taxpayer-funded healthcare programs. The FBI's investigation revealed a sophisticated network of recruiters, marketers, healthcare providers, and billing companies working in collusion to defraud the government. Section 7. Texas, Lone Star, Big Fraud. Texas faced a significant healthcare fraud problem, especially in home healthcare and mental health services. Operation Root Canal exposed agencies exploiting the elderly and disabled. Recruiters targeted patients, offering cash to enroll them. Patients received unnecessary care, while Medicare was billed for inflated services. Mental health facilities also faced scrutiny for billing fraud. The FBI's investigation led to numerous indictments, highlighting the need for vigilance. Section 8. Michigan, a web of lies unraveled. Michigan, known for its automotive industry, faced a healthcare fraud crisis. Operation Root Canal exposed deceit in home healthcare, psychotherapy, and prescription drug fraud. Unscrupulous providers billed for services never rendered and up-coded procedures. Home healthcare agencies exploited vulnerable individuals, billing for unprovided care. Prescription drug fraud was rampant, with doctors writing unnecessary prescriptions. The FBI's operation exposed the need for greater oversight and accountability. Section 9. Justice served. The aftermath of Operation Root Canal. Operation Root Canal culminated in a resounding victory for law enforcement and a stark reminder that those who exploit the trust placed in them will be held accountable. The operation led to the arrest of hundreds of individuals across the country, including doctors, nurses, pharmacists, and healthcare executives. These individuals faced a range of charges, including conspiracy to commit healthcare fraud, wire fraud, mail fraud, and money laundering. The Department of Justice, working in tandem with U.S. attorneys' offices across the nation, secured numerous convictions, with sentences ranging from probation to lengthy prison terms. The operation resulted in the recovery of billions of dollars in stolen taxpayer funds, demonstrating the FBI's commitment to pursuing justice and safeguarding taxpayer dollars. Beyond the immediate impact of arrests and convictions, Operation Root Canal sent a clear message of deterrence to potential fraudsters, reminding them that law enforcement agencies are relentless in their pursuit of healthcare criminals. Section 10. Safeguarding the Future. A resolute stand against healthcare fraud. Operation Root Canal served as a stark reminder that healthcare fraud remains a persistent threat, demanding unwavering vigilance and proactive measures to safeguard the integrity of our healthcare system. The operation's success underscored the importance of collaboration between law enforcement agencies, healthcare providers, insurers, and the public in combating this pervasive crime. In the wake of Operation Root Canal, law enforcement agencies have continued to prioritize healthcare fraud investigations, dedicating substantial resources to dismantling complex fraud schemes and bringing perpetrators to justice. The Department of Health and Human Services has strengthened its oversight of Medicare and Medicaid, implementing stricter regulations, enhancing data analysis capabilities, and increasing collaboration with law enforcement. Healthcare providers and insurers have also stepped up their efforts to prevent and detect fraud, implementing compliance programs, educating staff, and utilizing data analytics to identify suspicious billing patterns. Vigilance in the face of deception. The fight against healthcare fraud is a shared responsibility. Patients can safeguard their well-being by reviewing bills and reporting suspicious charges. Providers must remain vigilant in identifying and reporting potential fraud. Implementing compliance programs and educating staff are crucial steps. Insurers minimize fraud losses and ensure system integrity. Data analytics and thorough investigations are essential. Together we can create a healthcare system free from fraud.